Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches or migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we're going to talk about nitric oxide and how that can be helpful for you in managing your headaches or your migraines. This might be something that seems totally foreign to you, and don't worry, I'm going to educate you on what nitric oxide actually is and its implications on your body, and then how you can very easily and naturally increase the amount of nitric oxide through your system and the benefits associated with that. For those of you tuning in for the first time, I'm Dr. Taves. I'm your host of the Headache Doctor podcast, where every week we hop on the microphone and go through something and try to answer something, solve some riddle, some problem associated with headaches and migraines so that you can feel educated and empowered. And so thanks for tuning in this week as we jump into nitric oxide and its impact, potential impact on headaches or migraines. So first off, let's just start with an overview of what nitric oxide actually is. So nitric oxide is a naturally produced gas in the body. Okay, sometimes people have heard of nitric oxide when it's as it relates to sort of a rescue medication of sorts. When someone has a heart attack, it acts as a way to quickly dilate blood vessels and provide oxygen to tissues. And so when someone is in a situation like where they had a heart attack and we need to sort of, in a sense, jumpstart the heart, get oxygen to the vital organs of the body, nitric oxide does help with that. Now, we're going to be talking about a different function of nitric oxide and its potential impact on headaches and migraines. So it's a naturally produced gas in the body that acts as sort of a signaling molecule, okay? Its key role is vasodilation, so that means blood vessels get bigger or wider, okay? Vasoconstriction is they get smaller. Vasodilation is they get bigger. So more blood flow, which is a good thing, okay, in most situations. So more blood flow. So let me just back up. Vasodilation, vasoconstriction. It's not like vasoconstriction is bad and vasodilation is good all the time. Our body has responses to our environment, and there's systems in our body that will tell the blood and the oxygen to channel towards our internal organs. Okay, that would be more like rest and digest. All right, so the body needs to focus on resting, digesting, and so our internal organs will, like our stomach, our GI system, will potentially need more blood and oxygen to do its job as we rest and digest. And then the opposite side of that is the fight or flight, and that's where the blood and the oxygen will be channeled to our musculoskeletal system, so our muscles, in order to allow us to respond quickly, jump into action. Do we flee? Do we fight? That sort of thing. Make that quick decision. And so our body's also always adjusting the level of that sympathetic versus parasympathetic tone. So meaning the volume of one over the other. It's always constantly adjusting what that looks like throughout our system in response to meals, in response to stress, in response to whatever a day throws at us. And so a large part of that is the blood vessel dilation contraction. And so arteries are able to expand and contract in relationship to whatever the body tells them to do. And one of those signaling molecules is this nitric oxide, okay? So specifically, it's sent out when these specific blood vessels are told to relax or vasodilate. So more blood flow traveling through the blood vessels. When it comes to migraines, historically, migraines have been associated with, and even still, they're associated with vasodilation, vasoconstriction, something happening within the blood vessels of the brain. That's oftentimes where the pounding, throbbing sensation is associated with, as far as it's like I can hear my heart beat in my head, that sort of thing. There's something going on with my blood vessels. They're sensitized. this is a little bit of a tangent, but the blood vessels in the brain, the sensory input from those blood vessels runs through the same pathway that the neck would run through, and meets up in the brainstem, sends the signal to the brain. The brain has to decipher what's happening. Anything along that pathway, so meaning the neck being irritated, can sensitize those blood vessels in the brain. And so if there's a strong sort of contraction in those blood vessels, they're going to be more sensitive and potentially contributing to your migraine symptoms. And so something that relaxes those blood vessels can be a very helpful thing. We do see medications that correspond to like impacting the blood vessels in some way. I mean, it could be serotonin or things like propranolol, blood pressure type medications, things like that, heart-related medications historically, but have some sort of impact on head pain. Okay, so why is this relevant for headaches? Well, I was just bridging the gap for you, but enhanced blood flow may help reduce the headache frequency or severity. Okay, it supports oxygen delivery to the tissues, including the brain. All right, so oxygen to our tissues is very helpful. It allows the tissue itself to have a reduced level of stress through it when it has the proper oxygen that it needs. And then it's a way to counteract the blood vessel constriction or poor circulation that comes with tension related to the headache or the migraine. And then, of course, it puts us into more of a rest and digest state. So it helps to increase that parasympathetic tone. A lot of the patients we see are stuck in this sympathetic tone. They're stuck in this sympathetic nervous system response. So they're kind of always on this fight or flight state. And so having something like nitric oxide to take advantage of and increase the parasympathetic tone, the rest and digest state, to get improved blood flow, muscles to relax. We want to understand that, and we want to dive into that a little bit more so that we can take advantage of it. And it's great because it's naturally producing, created in our body, and something that we can then give our body the components it needs to continue making nitric oxide, so we don't have to rely on things like medications, and we can just be more informed and make a better decision with things like our diet or just activities, lifestyle, that sort of stuff. All right, so the role of nitric oxide in that parasympathetic nervous system, okay? So the chronic stress state that these patients are in does, it naturally keeps the body in that fight or flight state, okay? So it's a bit cyclical, but when the body's in pain, it also it's going to be challenging to get the body and the systems out of this fight or flight state, okay? So we have stress, whether it's emotional stress or physical stress. The patients that we're dealing with have usually both that they're dealing with that keep them in this fight or flight state, okay? Nitric oxide contributes to that shifting to resting and digesting, the parasympathetic mode, and it promotes muscle relaxation and then also improved digestion and reduced cortisol. I did a podcast on serotonin several weeks ago. If you haven't listened to it, go back and check it out. I talked about our GI system and the connection, the gut-brain connection there, and why our GI system and even something like digestion is important when it comes to regulating serotonin levels, okay? All right, so nitric oxide helps modulate neurotransmitter release, okay? So serotonin can act as a neurotransmitter. Neurotransmitter just means one neuron communicating with another neuron. So the neurotransmitters send those signals through our nervous system, through those nerves. And it can reduce the overactivity of nociceptors, which are the pain receptors in the body. Okay, so if you are in a chronic state of pain, we want to put as much of the pain-reducing molecules, signaling agents in our body, and nitric oxide being one of those. And then it facilitates healing by calming the nervous system. Healing is one of the things that naturally occurs when we're in that rest or digest state. That's why we know that healing is naturally occurring when we when we rest, when we sleep, our bodies need to sleep and our bodies need to recover. And so the healing process is sped up and it's sped up by the parasympathetic nervous system being ramped up and nitric oxide being a part of that. Okay, so practically speaking, how does our body create nitric oxide? So we've talked a lot on this podcast about breathing through the nose, mouth breathing being detrimental to our overall health. I've had interviews with breathe and sleep specialists, myofunctional therapists, which also connect to airway and improving the resting position of the tongue, lips sealed, all those good things that help us breathe through our nose. And then we've talked about the implications of mouth breathing on someone's health overall. So that's the interview with Dr. Goals or Jessica Martin. The importance of our airway cannot be overlooked, not just for headaches and migraines, but overall general health. All right. Now, here's at a more granular level and specific to headaches and migraines, how nasal breathing through your nose, helps with headaches and migraines, right? So nasal passages actually help produce nitric oxide. And not only do they produce nitric oxide, but breathing through our nose takes advantage of the nitric oxide that's present in our nasal cavities, in our sinuses that surround our nasal passage. And breathing through our nose allows the oxygen, the air passing through these sinuses to pick up nitric oxide and then send them directly to the lungs and then eventually into the bloodstream. All right? When we breathe through our mouth, we don't get the advantage of nitric oxide. So there's no natural interaction with nitric oxide breathing through our mouth. It has to go through our nasal passage, through those sinuses, and then eventually into the lungs. Now, there's a non-nasal breathing way that our body creates nitric oxide as well through our saliva and the foods we eat and things like that. But we're talking specifically about nasal breathing. And when we breathe through our nose, there are little tiny cells, epithelial cells, that line the sinuses, specifically the ethmoid sinus. And when the oxygen interacts with those cells have the nitric oxide. They provide it. It interacts with the air travels down to the lungs, and then the lungs receive that nitric oxide. It increases the amount of vasodilation, so the blood vessels around in the lung tissue itself. The alveolar cells they'll increase. There'll be an increase in blood flow. Okay, so they'll increase in diameter. And then blood flow, increasing through the lungs, will allow for a greater level of oxygenation in that blood and then running through our whole system. All right, so what can we do to practically help our bodies take advantage of this? So try slow nasal breathing. You may have heard of box breathing. Essentially, we're creating a box with our inhale, holding, exhale, holding, inhale, holding, exhale. So there's a box of, let's say 4 seconds in, 4 to 6 seconds or so, 4 seconds inhaling, so nice and slow. Hold your breath for 4 to 6 seconds. Slowly exhale for 4 to 6 seconds, and then hold for another 4 to 6 seconds. And you're just repeating that cycle, okay? So this is a way, breathing through your nose, to take advantage of nitric oxide production, which helps to calm the body, increase that parasympathetic nervous system, and oxygen intake through our lungs. Incorporate that as a daily breathing practice, especially if you're in situations where you know your stress levels increased. So use box breathing, the production of nitric oxide through your nasal passage, as a way to calm yourself down and put you more in that parasympathetic tone. So yeah, studies have shown nasal breathing increases nitric oxide and then oxygen uptake. And then also it's seen that athletes and performance experts are using it as a technique to enhance endurance and recovery. Okay, so recovery, because it's putting us in that rest and digest state. It's promoting the natural system in our body that helps us heal. and then enhancing endurance because we have more oxygen running through the system, which our muscles love. All the systems in our body have a lower level of stress when they have the available oxygen to them. Okay. So what are some natural ways? Well, before I get into that, let's just talk about the other avenue that our body would produce nitric oxide. So we have the nitrate to nitrite to nitric oxide sort of pathway that we can go down as well. So when we eat nitrates, so that would be foods like beets, arugula, spinach, celery, lettuce, those dark leafy foods. Those nitrates enter the bloodstream through the small intestine where they're absorbed, and then they enter the body, finding their concentration mainly in the saliva. And as they're in the saliva, they combined with the bacteria in our mouth, oral bacteria and tongue, and they convert into nitrites, okay? So one thing that's important to understand here is that what we eat provides us with the nitrates, okay? And then our oral health and the bacteria, having good bacteria in our mouth and around our tongue, allows that conversion from nitrates to nitrites. All right. So something like mouthwash, just sort of antibacterial mouthwash, eliminates basically all the bacteria, and it impedes this process from happening. And so if you are frequently using mouthwash, antibacterial mouthwash, you're limiting your body's ability to convert nitrates into nitrites, which is this other pathway to produce nitric oxide. Okay, so we want healthy oral bacteria, and potentially evaluate if you should avoid, or if you're using antibacterial mouthwashes, evaluate it if you can avoid that or go to a different method in order to improve your oral health. Okay. And then once it's a nitrite, you basically swallow that saliva, and then the acidic environment of the stomach and then different chemical reactions will convert the nitrite to nitric oxide, right? So once that saliva is interacted with the nitrates, converted it to nitrites, you swallow the saliva, and then the acidic environment of the stomach converts it to nitric oxide, and it's enhanced under low oxygen or acidic conditions. So if, which often occur during like exercise or stress. So when we exercise our bodies, when we put like good types of stress through our systems, when we challenge our systems, it enhances this whole process because it's saying, okay, we need more nitric oxide. Let's produce more nitric oxide. And so that's where like exercise and things like this come in. It naturally increases our body's systems that are set in place to produce nitric oxide. Okay. So we have these two pathways that we can take advantage of naturally. And one is through breathing through our nose, and the other is through diet and then good oral health. So foods like beets, spinach, arugula, celery, lettuce provide the nitrates needed. And then antioxidant-rich foods, so with vitamin C or polyphenols, these can be like nuts and fruits and vegetables and things like that. They help preserve nitric oxide. And then, like I said, avoiding the mouthwashes that destroy the oral bacteria needed for that conversion from nitrate to nitrite. Exercise is, like I was saying, is a way to boost nitric oxide production because it puts our body in a state where it needs more oxygen. And so it says, okay, like let's produce more nitric oxide so that we can get more of this vasodilation to help push oxygen to where it's needed. And so if you live a relatively sedentary lifestyle, try to implement exercise to take advantage of this. And there's lots of things that exercise helps with, whether it's like the production of serotonin. We actually know that 90 minutes of moderate intensity exercise can mimic migraine medications. And so a lot of these medications really, they become, in a sense, obsolete when we utilize the natural systems in our body rather than relying on a pill. Sunlight exposure as well. So UV light triggers skin cells to produce nitric oxide. So another way of producing nitric oxide. Short daily exposure helps circulation and mood. And so find time to get outside. I find it helpful to spend 10, 15 minutes within the first hour of the day, not only to help regulate the circadian rhythm of like sleep-wake cycle, but also to just take advantage of things like this, UV light triggering nitric oxide production. And then if appropriate, there's supplements that can help. So L-arginine and citrulline are some of the precursors to nitric oxide production in the body. And then, understand the root cause. I was talking to a patient recently who's working with a functional medicine or a naturopathic provider, and they did a saliva test to understand like what the nitric oxide levels in the body looked like, and it was deficient. And so going down whether it's a supplement pathway or these natural pathways to help increase nitric oxide in the body. And so just another data point, something else that you, the listener, can use in order to help you on your journey. All right. So just to bring it all back full circle. So a lot of headache and migraine sufferers are stuck in this fight or flight state, which is not helpful when we're dealing with pain, a chronic state of pain, and the sympathetic system is sort of like overactive. It's in overdrive. So we want to encourage nasal breathing, better nutrition, exposure to light, exercise, things like this in order to take advantage of nitric oxide production in the body through those different avenues we talked about. And then, of course, we want to use this as an adjunct to addressing the root cause, which in a lot of these cases is going to be improving mobility to the neck, getting rid of the actual source of pain itself. And so this podcast is more, this specific episode on nitric oxide is more of the environment that we experience pain in. And is our body able to cope with the pain that we're experiencing from potentially a neck, jaw, shoulder issue? And so in our 3-spoke framework, we have these 3 avenues that we look at when we're taking someone through our process. And so this is just another thing we use to say, okay, nitric oxide being low or deficient is not the cause. Nitric oxide being low doesn't mean that you have a one-sided pounding, throbbing, stabbing pain behind your eye or something like that. It means your body's in an environment where it may not be as capable of coping with that pain signal or addressing it. And it might actually contribute to the amount of tension that you have if your body's not producing nitric oxide like it should. So I hope that makes sense. I would encourage you guys to go on a morning walk, drink a beetroot smoothie or something like that. Breathe through your nose. Think about specific box breathing, maybe just for like 5 minutes every day. Avoid overusing mouthwash, and then maybe like an evening relaxation or deep nasal breathing practice, something like that. So start implementing these things in your day. Let me know how it goes. So send us an email, hello@noveraheadachecenter.com. Message us on our Instagram, TikTok, Facebook, however you guys interact with us. Hop over to those channels and let us know, or just comment on this. If you're watching on YouTube, comment below and let me know if this information has been helpful for you. Thank you all so much for listening to the Headache Doctor podcast. As always, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.